Have you had a genetic test that was more than 3, 4, 5 years ago? Well, did you know that even though your genes don't change, the way that we interpret genetic test results does? So because our technology used to be lower and way more expensive, it was harder to test multiple genes at once. But now we have something called genetic testing panels, where we can look at multiple genes at the same time. So if you only had a few genes tested for something like cancer or heart disease, you may want to consult with your provider to see if you'd benefit from an updated genetic test. For example, if you've only had BRCA genes tested because you have a personal or family history of breast cancer, the standard of care is now to do a full panel looking at all of the genes associated with breast cancer. And in a lot of these cases, we actually find genetic changes that explain the family history that aren't in BRCA1 or 2. So if you've had your genetic testing done a few years ago, then it may be time to update your testing. Or if you haven't had testing at all, it may be time to consider doing that genetic test.